I never wore my retainers after my orthodontics. Total different scenario. No problem not wearing this. I don't want to take it out to eat. So, and if it is out for any length of time, it's like a piece of me now. I mean, if it's out for any length of time, I start feeling weakness. It feels terrible. You know, the back starts to tighten up. My neck feels tight. My shoulders feel tight. Everything just kind of goes backwards. So I don't even really know how to explain it. But I know, I just know I don't want to be without it.
You really didn't think this was going to work?
No, not at all. I just had that ER visit, and I had basically pretty much a near-death experience. My vital signs were all off. I just felt like, I mean, I can't really explain it, but I knew that, you know, I had come out of the ER, and I just told my mom, you know, that I just couldn't struggle anymore, that death was imminent, and this is what was going to happen. And then I met with Steve Winley, and then I had full faith in him after speaking with him, and just really believed that that airway was the trump card for everything. And I told him, I said, you know, Steve, I want to believe you, but I don't, because every light at the end of my tunnel has always been another train.
You used an expression a little bit ago that I'd never heard before. You said you had to reach up to touch bottom.
Right. I was a mess. Yes, a cumulative effect. I thought it was because of other life situations. It was inconceivable to me that it could be a breathing issue. But yeah, by the time I got into the ER, my blood pressure was staying at 180/120. My vitals were just all off, and I just had the overall feeling of, you know, this is it. I'm really just done here.
It was interesting the last time about your blood pressure, where at the very start of the process, when you were sitting here and you were quiet, it started out as 134/95. Almost immediately after we placed the orthotic, it went down to 128/85. By the end of the appointment, it was down to 113/82. When you were a young child, do you have any family stories about what you were like as a young baby?
My mother says that I didn't sleep. A young child, I could never catch the school bus because I couldn't get up. I would go to bed at 4 o'clock in the afternoon and sleep till it was time to go to school the next day. When I would, you know, fall asleep in class, I could never function in what you would call a quote-unquote normal type scenario.
So, from the time that you were a little kid until now, how many physicians do you think you have seen trying to get help?
Oh my goodness. There is a laundry list of people.
Has anybody ever asked you about your sleep?
No.
Until Dr. Winley saw you?
No, I've had rheumatologists, I've had therapists, I have run the whole gamut. I've gone as far out as California for, like, you know, inner healing and therapy type help, trying to locate a problem or an issue. I've had countless therapists here. I've been around the globe, basically, and the doctor was actually wanting to send me to the Mayo Clinic.